The longer you take a study out, the more likely you are to see people not doing well on that drug, right? Or developing side effects from that drug. So the pharmaceutical industry doesn't favor long-term studies for monetary reasons and for outcome reasons. They don't want to show that their drug actually doesn't do well.
There's as much marketing in the tests that are devised to measure the outcomes, in the investigators that are hired to conduct the study. All of that stuff is marketing, but it's presented and manufactured and published as science.
So here's how it's done and how it was done. They funneled all sorts of money to what are called thought leaders, academic psychiatrists at prestigious American universities, Harvard, Stanford, Johns Hopkins. And those academic psychiatrists began working for the drug companies as consultants, serving as their speakers, advisors, etc. You would start with a clinical study of the drug. But who's designing the study? The pharmaceutical companies. They know how to design it to make their drug look good. That's step one. Who then analyzes the data? Well, their own people do it. It's done by the drug companies themselves. Third, then, who writes the papers? It's actually ghostwriters hired by the drug companies to write up the study. They now present this study to the people that they want to be the big names of the study. And then those thought leaders basically sign off on the ghostwritten papers, and they become, quote, the authors of the published paper. The former editors of the medical journals like JAMA and New England Journal of Medicine and BMJ, British Medical Journal, they've all said that, like, basically we became vehicles for story laundering. It was a corrupted creation of an evidence base. Now, I'm a practicing doctor in some town. What am I going to believe? Well, I'm going to believe, you know, Mr. Dr. Bigwig at Harvard University, that this is the best science. So my obligation is to use the very drug they say is so great. So, for example, Prozac. Prozac didn't really work in the trials. Prozac had all sorts of adverse effects. And those of us who are old enough to remember when Prozac came to market, the drug itself was on the cover of magazines. Our powers are such now that we can give you whatever personality you want. That's how great our knowledge is advancing. That was the story told. What did science tell us? Did you know what they found? In the 1970s, very first studies done in Germany. What do they see? All sorts of psychotic events, worsening of depression, homicidal, suicidal impulses, so much that the German authorities said, this is a dangerous drug. We're not going to approve it. And now go read the studies that were reported by the Americans. The psychosis is gone. The homicidal problems are gone. Imagine you're a mother, and I know mothers, who said to their kid who got depressed over breaking up with a girl or something like that. The doctor says, oh, Prozac doesn't increase suicide risk. And then a week later, that kid hangs himself. That's in a real case. Can you think of any worse corruption of that?